Good day everyone. So we are already on the last stretch in chapter of pathways to pregnancy and parturition. This presentation will cover topics regarding puerperium and lactation. But first, let's have an overview of the main topics that will be discussed in this presentation. The lactation and puerperium are initiated immediately after parturition, and for a period of time, these processes occur simultaneously. Lactation is the synthesis, secretion, and removal of milk from the mammary gland. Puerperium, on the other hand, is the period after parturition when the reproductive tract returns to its non-pregnant condition so that the female may become pregnant again. Let's delve deeper into the basics of these processes, starting with the puerperium. The puerperium begins immediately after parturition and lasts until reproductive function is restored so that another pregnancy can occur. The time required for complete uterine involution or repair and ovarian activity to resume in the postpartum female varies significantly among species. Presented on the upper left part of the slide is the time required for complete uterine involution in various female species. Among our domestic and livestock animals, the bitch requires the longest time for complete uterine involution, which is 90 days, followed by the dairy cow, which requires 45 to 50 days. On the other end of the spectrum, the mare requires the shortest time for complete uterine involution, which is only 21 to 28 days, followed by the sow, which requires 28 to 30 days. The queen, beef cow, and ewe, on the other hand, require 30 days to completely undergo uterine involution. Shown on the lower left part of the slide is another data showing the time required for resumption of ovarian activity in various female species. Among the presented animal, the ewe requires the longest time for resumption of ovarian activity, which is 180 days, followed by the bitch, which requires 150 days, and the beef cow with 50 to 60 days. As for the shortest time, the mare takes the lead with only 5 to 12 days, followed by the sow, which requires 7 days. The queen and dairy cow, on the other hand, require 5 to 12 and 30 days respectively for the ovarian activity to resume. So what is an ideal puerperium? Should it be long or short? In this case, we will be focusing on our livestock animals, specifically the cattle. It must be emphasized that in many polyestrous animals, cattle for example, the shortest possible puerperium is desirable because eligibility for a subsequent pregnancy is of high economic importance. Conversely, the longer the puerperium, the longer the delay of a subsequent pregnancy and the less efficient the production process becomes. For example, in dairy cows, frequent pregnancies are required for maximum lifetime milk yield. In swine and beef cows, the shorter the interval between pregnancies, the more offspring are produced and more efficient the production of meat becomes. So there are four major events of puerperium. First of which is the myometrial contractions and expulsions of lochia. Second is the endometrial repair, followed by the resumption of ovarian function. And last is the elimination of bacterial contamination of the reproductive tract. So these events will be described in more detail below. First is the reduction in uterine size and volume is usually brought about by the first major event of puerperium, which is the myometrial contractions. So immediately after parturition, the myometrium undergoes strong repeated contractions. The purpose of this contraction is threefold. First, they facilitate discharge of fluids and tissue debris from the uterus. Secondly, the contractions compress the uterine vasculature and help minimize the possibility of hemorrhage. Third, myometrial contractions reduce the overall size of the uterus. Of the species presented in this topic, timely uterine involution is most important in the postpartum dairy cow. So in most species, frequent postpartum suckling occurs, and oxytocin is secreted. In suckled animals, uterine contractions occur on a frequent basis. In the dairy cow, however, the calf is usually removed within 24 hours after parturition, and milking takes place only 2 or 3 times per day. Consequently, oxytocin episodes are reduced, myometrial contractions are not as frequent, and uterine involution can be delayed. However, it is important to note that delayed uterine involution is an important factor which limits the fertility of a cow. So immediately after parturition, the uterus undergoes rapid but highly coordinated atrophy so that in a relatively short period of time, the uterine mass is reduced to its non-pregnant size. In all species, mark size reduction occurs during the first several days after parturition. In fact, in the dairy cow, myometrial cell size decreases from 700 micrometers on the first day after parturition to 200 micrometers a few days later. In most species, myometrial contractions occur in 3 to 4 minute intervals for the several postpartum days. These strong, high-frequency myometrial contractions subside within several days. The exact time that these contractions stop depends on the species. So the figure shows the changes in the uterine length and weight at various postpartum days. As you can see, the uterine length and weight is as high as 85 cm and 10 kg respectively in the day after parturition. The uterus would then undergo a dramatic change as the days go by. By day 20 or day 20 postpartum, the uterus is already returned to its normal size, which is 20 cm in length and 1 kg in weight. So shortly after parturition, the body fluid is discharged from the reproductive tract. So this event occurs during and after the myometrial contractions. The discharge expelled from the vulva is known as the lochia, which is typically a blood-tinged fluid containing remnants of the fetal placenta and the endometrial tissue. So lochial discharge occurs between 2 and 9 days in postpartum dairy cows, and an increase in blood and tissue debris in the lochia is normal and occurs between 5 to 10 days. This increase is due to the sloughing of caruncular surfaces that leaves the vascular stubs that leak blood. Obviously, with significant myometrial contractions occurring for the first 7 to 10 days, there will be a reduction in the volume of lochia within the uterus. In a dairy cow, for example, up to 2,000 ml of lochia can be expelled from the uterus during the first 2 to 3 days after parturition. By 14 to 18 days, lochial discharge is almost non-existent in most cows. So lochial discharge is physiologically normal in all species. However, it is often interpreted by observers to be the result of uterine pathology, especially in the dairy cow. Therefore, the first instinct of the reproductive management team is to treat the animal for non-existent pathology. This results in unwarranted treatment, which is financially wasteful, not effective, and it often prolongs uterine involution, especially if the uterine lumen is invaded. So what is the implication of this? So if we can recall, delayed uterine involution limits the fertility of cow, which in turn affects the efficiency of a production process. Now we have the caruncular repair. So after the separation of the fetal cotyledons from the maternal caruncle, which usually takes place within 8 to 12 hours after delivery of the neonate, vasoconstriction takes place in the stalk of the maternal caruncle, and then necrosis of the caruncular tissue follows. So necrosis is the irreversible cell death that leads to sloughing of the caruncular mass, which leaves necrotic tissue in the lochial fluid inside the uterus. Some blood is released from the caruncular stalk, generating a blood-tinged fluid which is earlier known as the lochia. So about 5 days after parturition, the caruncle begin to lose their cellular organization and integrity. This results in chunks of the caruncles detaching from the surface, leaving remnants of blood vessels exposed to the surface. After the decidual tissue of the caruncle is sloughed into the uterine lumen, the caruncle then begins to undergo repair and is covered again with endometrial epithelium. So here is an example of a caruncle. At the same time caruncular repair is taking place, the intercaruncular surface also undergo repair. In general, the epithelium of the intercaruncular area of the endometrium repairs at a faster rate than do the caruncles. The repair of the intercaruncular endometrium is generally complete by the 8th postpartum day. So the delay in a caruncular repair when compared to the intercaruncular epithelium is associated with the large mass of the caruncular tissue that must undergo necrosis and sloughing before surface epithelial repair can take place. So this marks the end of the discussion about Puerperium. The next topic, which is lactation, will be discussed by Rodilyn, Marz, Andea, and Chloie, Feyne, Hierro.